1 in 5 people worldwide have inherited high lipoprotein a, and most don't know it. Unfortunately, the first sign of this condition can be a heart attack or even a stroke. So joining us now from the Family Heart Foundation, our founder and CEO, Katherine Wilemon, and Dr. Seth Baum, Chief Scientific Officer of Flourish Research. We're so happy to have you both here today. Katherine, let's start with you. We understand that you had a heart attack at 39 years old. Can you please share your experience with us?
Absolutely. So I was out gardening and I suddenly developed crushing chest pain and pain radiating down my arm. And I knew instantly that something was wrong, but because I was so young, when the paramedics came, I really had to advocate for myself as well as with the physicians in the emergency room. But what they did discover was that I had 100% blockage of the main artery that feeds your heart blood. And so I'm really lucky to be here. And it took me a long time, but what I also discovered was that I had inherited 2 genetic conditions that really increase my risks of cardiovascular disease, especially early in life. One of them is called familial hypercholesterolemia. It causes high LDL cholesterol from birth. And the other that we're here to talk about today is elevated lipoprotein a. Now, the thing about elevated lipoprotein a is, 1, probably nobody's ever heard of it, but 2, 20% of the worldwide population is estimated to be impacted by this condition through their genetics. What we know from Family Heart Foundation research, though, in America, over the last 10 years, less than 1% of individuals have been screened. And if you know about genetic risk of cardiovascular disease early, there's a lot you can do. And so it's really important that people find out sooner than later.
Definitely. Prevention is key, and knowing your body and, like you said, advocating for yourself. Dr. Baum, what does it mean, though, if you do have elevated lipoprotein a?
Elevated lipoprotein A conveys a significant risk of heart attack and stroke, 4 times the risk of somebody who doesn't have an elevated level. Lp(a) is like a really, really bad LDL particle. And what I mean by that is it causes plaque formation like LDL does, but it also causes inflammation, which is bad, and it increases the risk of clotting. And all that conspires to put people at risk for stroke and heart attack, which of course can be devastating events. We should know that it's inherited, and because it's inherited, if you have an elevated Lp(a), well, then it's important to check your whole family for elevated Lp(a). And finally, it's also very important to understand that if you identify this risk factor, although we don't have a therapeutic available to deal with it yet, they're in development now in clinical studies, we do have many other ways to reduce cardiovascular risk, probably the most important one being reduce your LDL cholesterol. It's not done enough in the United States, and as a consequence, we genuinely have a public health crisis about that. So that's how one should approach Lp(a).
Definitely. We could, as Americans, really improve our diets, right? Katherine, and you've dedicated your life to raising awareness of heart disease and as a public health issue, of course. What is the Family Heart Foundation doing to create awareness of elevated Lp(a)?
Well, we work with health systems and healthcare practitioners and advocate on a policy level on a day-to-day basis all throughout the year. But in the month of March, we go out to the public, just as we are doing today, so thanks for the opportunity, to raise awareness of elevated lipoprotein a. March 24th is Lp(a) Awareness Day, and we have tens of millions of people around the globe who join us in raising awareness of this condition. If I just may say, you know, cardiovascular disease is the #1 killer of Americans and the #1 cause of disease, but it's not only diet and lifestyle, and that's really important to understand. There are genetic drivers of cardiovascular disease risk that we need to understand and be screening for early.
Yes, thank you for that. So where can we go for more information on all of this?
People can go to familyheart.org. We've got a lot of accessible information, and also we have a patient navigation center if someone wants to talk to a real live person about what might be their own next step or steps for their family.
Wonderful. Well, thank you both so much for joining us today. And Katherine, I'm glad you're doing well. And if you'd like to see this interview again, you know you can head to our website, and that's firstcoastliving.net.